All right, doctor, very quickly, let's zero in on allergies for a moment. Talk to us about allergies, really. We would like to know more about the symptoms of allergies. I would also like to know if there are remedies, things that parents should do to reduce, the occurrence of this cough as a result of allergy.
Each time we mention that word allergy, we are only saying the body, a particular part of the body is hypersensitive to things around it. So if we are talking of allergic cough, for example, it means the respiratory pathway from our nostrils to our trachea to our lung airways is unusually sensitive. So what ordinarily people, when you pass a place and you come in contact with and you don't react, but for the fact that these people are unusually hypersensitive, the body reacts in an exaggerated manner to that condition or to a substance. That is essentially what an allergic cough is. And basically, there are common things that they react to. One of them is dust, pollen from the forest. They can also react to the presence of pets around them, dogs, cats, from their fur. They can also react to paint. They can also react to a whole lot of smoke, either from the kitchen or from outside. There are also others who react to even the presence of cockroach. Yes, there are people who react to presence of cockroach. Then most people will also react to things like paint, insecticide, and all that. Mosquito killers. These are things that people react to when they say they are when they have allergic cough. And in terms of taking care of it, it is obvious that one important thing is the allergic component is already in the body, meaning this body is created by God or he has inherited it from the parent to be unusually sensitive to some things. So that is basic to that body. So basically, if you are going to manage such a child, it is like you are going to manage, not really curing the problem per se. So, and how do we do that? Those things that trigger that type of cough, the child, as much as possible, when identified, should avoid them. And once you do that, you find out that the cough disappears most times. And until it gets exposed to it again, the cough doesn't show. So that even though there are drugs that we also give to actually mitigate body's action in responding, reacting to virtually everything. There are medications that will give to say body calm down a bit, don't react to everything you see. But that really, in most cases, may not really solve the problem. The child still needs to avoid coming in contact with such irritants. And there are so many of them that really, there are so many. And we have even seen, I've seen some of my clients that
Patients.
even after leaving the shore of this country and they go abroad, you see them coming to say, the allergic, the cough has disappeared, and the only thing you can say is because yes, because the environment where they are there is unusually very clean compared to what we have here. We have so many dust, dirty environment, dusty wind, and what have you, smoke everywhere. Those are the things that trigger it around us here. So when they go to cleaner environment, you see that they hardly complain of things like that.
All right, you said something. You said it's not to treat it, it's just to manage it. That scared me for a moment. So, for parents who have children who are allergic to some of the things you have mentioned, are you saying that the parents shouldn't look forward to a time when the cough and the other symptoms will stop totally? All they should just do is to ensure that that child's environment is kept as hygienic as possible.
Yes, the nature also has its way of dealing with some of these things. We have seen so many children after a while, the body actually gets uh, adapted to that reactant, to those irritants. And in such a way that when it now comes in contact with it, it doesn't react again. We have seen cases like that, and we have also seen even some of them, even from childhood, transcend into to adulthood, and it continues. So that is where nature comes in, really. And then that also depends on what that child has actually inherited from the parent. The nature of allergy that he has inherited also plays a role. There are some, take for example, there is what we call a atopic dermatitis, which is also a form of allergy, but this one is to the skin. While some children actually do outgrow it after a while, some continue even into adulthood.
All right. Now, you mentioned some remedies, talking about, okay, if it's about dust, we keep the house clean and all of that. But very quickly, I would also like you to probably mention more remedies, really, because I've had situations where a pediatrician told, well, the client that maybe the patient, or, well, you can use patient or client, what the pediatrician told them to avoid using cloth chairs in the house, and they should also avoid using rugs and stuff like that. I'd like you to talk more about that. Will all of this also help in mitigating or ensuring that the child doesn't come down with another bout of coughing and the other symptoms?
Yes, one of the basic things you can do at home is to ensure that the house is made as clean as possible. You should ensure that all the dust in the house, and this is not just an one-off thing, it has to be done repeatedly. Our nets can harbor a lot of dust. Many of those children react to actually from dust. If you go to our window blinds, a lot of dust, and those are the areas children like to do their pick and pull and what have you.
Absolutely.
Yes, the net on the window can harbor a lot of dust. Many of these we are talking about, it is dust, dust, dust. Thank God this year we hardly use a rug in the house again. Those days, rug can harbor a lot of dust, and children like to play on the rug. So it seems invariably coming in contact and roaming around with the dust in there. Then apart from that, we also prefer that when it comes to fabrics, children who have such allergy should use more of the cotton made fabrics, so that the nylon type are the ones that are also likely that children also react to more than the cotton. So if a child is also having issues with they should also use more cotton dresses. Then apart from that, another thing that can also assist is to use more of soap for washing of the clothes, because the detergent too also harbors a lot of things that children can also react to. And these are some of the things parents won't even take cognizance of. And I've washed the clothes, I've done this, I've done that. So, but those are the areas where children funny enough, react to, and they won't know, and they keep complaining, what exactly is this with this cough coming on and off? But the irritant, the agent that is stimulating is actually is at home. So if they look well, some of the perfume we use, and we forget to mention that all this while, perfume, air freshener, those are things children react to, and all of them can cause cough. If you know that a child has some level of allergy and you want to use such a thing, it's difficult. You can't use such a thing where the child is. Even when you spray it, you know that it remains in the room for such a long time. And when that child comes in contact with it, the next thing is overnight, the cough has been recharged again. So those are some of the basic things we should also look at. Yes.
Okay, very quickly, talk to us about humidifier. What role do they play in all of these?
Yes, humidifier to also assist in the sense that if we are breathing in air that is also dry, it's also one of those things that can actually stimulate, that can trigger cough. So that's why every time you come to hospital and you see us giving oxygen to anybody, we always want you to pass through some water, so that it can have some level of humidity to it, rather than it going directly to the patient dry. Because the humidify, part of the things our airway does is actually to sieve the air that we are breathing in, and also has some level of humidity to it. So if you are taking it dry air, it means the tendency it can also worsen the cough that we are having. So humidity assists in soothing the airway and then making allergy, less obvious.
All right. Now, well, we have used all these, the remedies, and yet we see no improvement. What should be the next line of action?
Yes, I also want to advise parents that if you have a cough that has persisted, please do not hesitate in seeking medical help. This, you can see that all the cough I mentioned, there is a thin line between them. If you look at it really, there's a thin line. So don't misjudge and think, this doctor has said this should be allergic cough. You may be wrong. It may not be allergic cough. There may be something underneath it that needs to be taken care of. It may just be a course of antibiotic that child needs to take, and the cough disappears. So the whole essence of this talk is for parents to, if you have tried your own remedy for a few days and this cough has persisted and you are not comfortable with it, please seek medical help. Walk out to your doctor, and if the doctor has attended to you and you can also insist that you want to see a pediatrician who can take time to evaluate that child and find out what is the cause, and also counsel the parent accordingly. Because sometimes I know that there are so many home remedy people talk about. You want to use honey, you want to do all that. If you have used all those remedies and it has not helped that child, please do not hesitate to seek the help of a doctor.
All right, thank you so much, Doctor. We've had a great time listening to you. In closing, I'd like you to share maybe your parting shot with us.
I want to appeal to parents once again that it is important. A child coughing for a whole 2-3 weeks is not something one should joke with. There are more serious things that can be taken care of if you visit your doctor early enough. So do not hesitate. Do not say my friend, my neighbor uses medication, the same will work for my child. No two children are exactly the same, genetically and even socially too. So our advice is seek medical help before it is too late. Thank you.
All right, thank you so much, Doctor, for sharing your thoughts with us. We do appreciate every one of them.
Thank you. You're welcome. Thank you, listeners.
We'll be speaking with Dr. Oluwole Ayodele, a consultant pediatrician at Lagoon Hospital. I guess you had a great time listening to him. My name is Perpetua Fasami Peter. Bye for now. See you some other time.